Hello, how are you doing?
Very good and very good morning to all, and really proud to see the way you have come out with this um, program for all the Global Uro-Oncology Congress being held here.
Also, it feels great to have you here today with us, between us. So, please tell me something about yourself.
I am Dr. Anil Kumar Varshney and I am Senior Director Urology and Andrology at Max Super Speciality Hospital, Shalimar, Bagh. And I am in practice since 1983, so practically 40 years of my experience. And we have been dealing with all kind of urology cases throughout. Initial journey was that I have been in Maulana Azad Medical College for 12 years, and after that I went to Moscow, a research institute of urology, which is a 400-bedded institute of urology, where we had 8 subspecialties of urology. Uro-oncology was one of them, and I had the privilege to work there for 4 years. Every subspecialty had 50 beds. We had renal transplantation unit. We had 2 helicopters of our own to get the cadaveric kidneys. So it was a great experience. And then when I came back to India, the urology was in infancy. People used to carry their instruments in the dicky of their car and move from nursing home to nursing home. So I said, this is not the future, not my cup of tea. So we decided to institutionalize urology in India, in private sector. So that is what the journey started. I joined RG Stone in 1992, and then we made it, it was a negative institute, but then we made it positive, and then we got this banks supporting us and created 20 centers of excellence all over the country. So urology, by the name of RG Stone Urological Research Institute, we could establish, and I could train 2 urologists per center, pan-India, to run around to take care of urological services, because that is how we sort of stimulated this institutionalization and all subspecialties of urology. And then I was having itching that this was a small setup. It was not having ICU, CCU backup, and we were getting a lot of comorbid cases. And therefore, the itch was to have a setup with support services and a teamwork. So with this intention, 10 years earlier, I shifted to Max Institute of Urology, Max Healthcare Groups. And from there we established an institution. Now we are 7 urologists looking after various subspecialties of urology. So the journey was what I saw in Moscow. I have been able to recreate some of it in India, and still it is miles to go. The reason being that India is growing, but it is growing very slowly. Our patients need a lot of works, and as far as looking at global centers, the global centers today, they are giving specific services. Like we have Dr. Vipul Patel, so who is doing only robotic radical prostatectomies. So we have institutions of stone disease. We have institutions of oncology. So for that matter, still India needs lot of super subspecialization so that we can give better outcomes to our patients. Because the current situation here is that we are looking after each and everything because the number is less. We are hardly 4,000-5,000 urologists for a country of 140 crores. And that is where the actual challenge comes. And how we are beating that challenge is because of volumes. We have to work harder, we have to do more cases, and the remuneration is less because the population is poor. So basically, if we compare from Western world in India, the healthcare has miles to go. The reason being that the society has to be looked after, relatively poor, but I am happy that Ayushman Bharat has come, and that is a scheme for 50 crores underprivileged sections. But rest of the say 90 crores population, they'll need much more infrastructure, much more quality services, because ultimately, initially what was happening is that patients who could pay in India, they were going to abroad. Even the politicians, they go abroad. But now what we have been able to do is that we have been able to deliver quality work in India. All kind of technology is now available in India, and what any center in any part of the world is doing, we are doing it in India. So that is the beauty, that today our patients don't have to look to the West. So that is something which has really come up, and I am sure that in future we will be looking at the West coming to India, because our numbers are going to grow. We are now adding at least 400-500 urologists per year. So we are in a process of creating lot of infrastructure. Like USA, we are planning to have associates, urology associates. So associates means senior people and junior people will join hands, and they'll create institutions of excellence in all states and cities of India. So that is the future I foresee for the country, that we should be able to provide quality care with better outcomes for majority of the citizens who can afford. They should be able to get the best.
I definitely believe in that. The process is slow, but I know India will definitely achieve it. Will do it. And doctors like you will just make India shine brighter than anything else.
No, we are really proud of our people, our urologists, our members, who are really very hardworking, because they work at least 12 to 16 hours a day, just because the load is too much and the remuneration is very low. But then through you, maybe that I am able to approach to the government, that they should think, because lot of the unfortunate part is that majority of the doctors, urologists, they die young. We lost, unfortunately, our secretary, USI, Dr. Lakshman Prabhu, recently. He was hardly 60 years of age. So that is something that the brunt of the whole society comes on people, because number is less. And you have to take care of the patients, you have to take care of the members, you have to take care of the society. So it's a large chunk, and people are doing lot of work. So the unfortunate part in India is an inadequate work-life balance. So if you look at a global scenario, I must tell you that all posts of urology which are advertised in US, they write that a balance between work and life will be provided. With the post of urology, they will give you how many swimming pools and the golf courses and all, what they are with the institutions. Such a thing is not yet in India. In India, it is
Short number of doctors here in India, so
Yeah.
the burden is getting higher and
Yeah.
higher on you.
So we have a cultural shock when we see the kind of work we do, and most of the people in the Western world, they are surprised at how much these people do. When I was at RG Stone, we used to do 20 to 25 cases. Single-handedly, I have done 20 to 25 cases per day. So that is something that we have to change, because we have struggled, we have suffered, we have a lot of to say, because the mission was stone and prostate disease free India. That mission, we got 100 crores from ICICI Ventures, and I could establish 20 centers in different states and cities of India. But that requires, everybody can't do that. They all need good balance, work-life balance. So I'm sure we should be able to achieve it, and good, because ultimately the goal of any society is work culture as well as welfare of the providers. So I foresee that our members should be able to provide better quality services, at the same time be able to keep themselves and their family healthy. So that is very important.
So let me add one more question for you, which is, what are the most common lifestyle issues you have come across in the patients?
Patients actually in India, we have unfortunately uh, very unhygienic situations. So the commonest problem we come across is urinary infections. So
Very less toilets everywhere.
toilets, even the toilets, we people, they females, they use jets, and the jets, they all stool, they can go into their urinary passages. So ascending pyelonephritis is a very common problem. So hygiene is something which needs to be education programs. And similarly, from women, the men gets, and they are suffering from prostatitis. It's a very common chronic prostatitis, and they have all kind of sexual dysfunctions, andrology issues related to this discharge, premature ejaculations and all. So this is something our society is really having. The other common problem is stone disease. 60% of the patients which come to us is the stone problem. And these stone problems, they ultimately they kill the kidneys. Why? Because the stones, they obstruct the passages. Sometimes if it's a single kidney, then you have a very high chance of losing the kidney. So a stone is a very, and that is what ultimately translates into a poor quality life. And then the other problem is prostates. 20% to 30% of the patients, they have benign prostatic enlargement. Prostatic enlargement starts from the age around 40 years of age in men, and after that, this causes lot of problems in urination. So urination problems like it could be hesitancy, urgency, poor flow, blood in urine, pain in urine, all these problems they get combined, and ultimately it may cause blockage of urine, retention of urine. So this is a very common problem, and for that again we have lot of advances. For example, now we have lasers which we are able to enucleate these prostates and give them a good lease of life. Any laser prostatectomy can give additional 10 years of extra life. So that is something that people are not aware of, but by these kind of programs you are conducting, I am really proud of you, that people will get aware about prostate diseases, about urinary stone diseases, about urinary infections, andrological issues, and the worst thing is the cancers. The prostate cancer, the urinary bladder cancer, or the cancers in the kidney, they and the testicular or penile cancers. So they all ultimately can be detected timely, and therefore screening is important. People who smoke, they get bladder cancers. So it is very important that they shouldn't smoke. The other lifestyle issues, they are like PSA is something which detects cancer of the prostate. So in the Western world, any patient who is suspect of having urinary symptoms, they do PSA levels. And this PSA level is something which is important. Unfortunately, there are few things which even today have not come to the preventive healthcare programs, and that is uroflowmetry, for example. Now, uroflowmetry is one thing which can detect most of the urinary flow issues in the simplest of the tests. People don't complain, but something like submeatal stenosis or stricture of the urethra or stones or benign prostatic enlargement, they can be picked up by simple uroflowmeter. In Western world, even the toilets, they have a uroflowmeter. So I am yet to see in India that we are not yet, even in hospitals, many of the nursing homes, they don't have uroflowmeters. So people struggle from pillar to post to get a good uroflowmetry done. Similarly, the bladder scans are important. PSA, as I said, is important. So there are a lot of ways in which we can detect cancer early. And I am sure that if we can improve the hygiene, if we can improve the lifestyle, if we can, because this prostatic enlargement is also associated with lifestyle issues. So if you can give them a good life, metabolic syndrome and BPH are one and the same thing. So today in urban dwellers, you have blood pressure, diabetes, and these are the things which are also the lipid profile derangements. These are the things which are associated with benign enlargement of the prostate. So something which is important is that we have to give a healthy lifestyle, and the most important thing is preventive health care. Unfortunately, today in India, a patient will go to a doctor only if he has a problem. We have not been able to convince our society that health or the life has a value.
Also, when the problem increases, then only they will.
Yeah, so they neglect their diseases and they keep on avoiding meeting a doctor. So that is something which has been able to means our average lifespan is definitely lower than the Western world. The reason for that is that we don't feel going to a doctor. Somehow there is a scare in the minds of the public that if they go to a doctor, a lot of money would be spent. And the reason is that why all this kind of a scare is, I think I always relate it to cars. 40 years back, the car was, there used to be a lot of cars which used to be standing on the road because they used to get something, engine problem, dynamo problem, this problem, that problem. So car gets, and public used to go to the mechanic only when the car is not working. Now, similar thing, but then the whole revolution came in car sector or the vehicle sector. Now there is preventive maintenance.
Timing to timing, you have
Yeah, so you go do a car service every say 6 months to 1 year. Now you don't see those broken cars on the roads. So similar thing needs to come to healthcare. Healthcare means you don't need broken patients in coming to the hospitals. You have to keep the society healthy. Now to keep a society healthy means you have to have a preventive maintenance. I always ask my patients, which is more valuable, car or you? So unfortunately in our country it is more value is given to car because you buy it. They spend lot of money. And I say that you don't know because you have come from your mother which has given you life free of cost. So somehow you don't value your life. But a good life, good person can get 20 cars or even more.
Yeah.
So which is more valuable? Then the patient understands that yes, my life is valuable and I must look after it. So I think the message is that we must educate the public the value of life. We can't educate to real poor people because for them it is food, clothing and shelter is the primary problem. But the people, as I said, that 90 crores which are now able to get food, clothing and shelter, then they should think of good health. And they should be able to give, if they are healthy, they'll educate themselves, their children will be healthy, and then we will be able to think of that society where we will be able to provide quality care at par with any Western world. So now the thing is that we have to work hard, and it is not one, it is all citizens who have to work hard. Unfortunately in India what was happening? That everybody used to say government will give the job. I always ask them that you have to change your mind. It is not government. You have to give the job. So if it is a mindset which has to change, the 140 crore people, they start thinking that way, entrepreneurship. मोदी जी क्या कहते हैं कि पकोड़े की दुकान खोल लो, better than employment की क्या problem है?
Exactly.
तो अगर आप अपना
Start from this, then you will grow into a.
That is up to you. That is up to you. अब हर बंदा जो बैठा है वो कहता है मेरे को तो जॉब नहीं है, जॉब नहीं है, जॉब नहीं है. अपोजिशन पार्टीज टेक ए सॉर्ट ऑफ दिस थिंग ऑफेंस दैट नहीं इंडिया में अनएम्प्लॉयमेंट है, पॉवर्टी है. हु विल क्रिएट दैट, हु विल रिवर्स द साइकिल? It is us only. It can't be one minister, two minister, prime minister, president. They can't do it. It is the society which has to change. And this social change ultimately will make us wealthier, prosperous, comfortable. And what the doctors are taking the load on their hearts today should decrease just by a good, healthy society.
That was a really informative session. I really loved it, and I hope people will hear this and they will learn that lifestyle, maintaining lifestyle is really important in today's time, and educating about everything about how to live, how to maintain their healthy lifestyle is really important. So it was great having you here today.
So nice of you. Thank you, and thank you for calling me for this session. And I'm proud that we will be able to convey to our people about quality life and helping each other. Because until unless we develop that model, that you look after me, I look after you, nobody else is going to look after us. Thank you. God bless you.